Our guest today is someone who oversees national account management and sales for a pharmacy benefit management company.
Pharmacy benefit management company we're the company that handles the prescription drug card part of employees' health benefits. So if you were, whether you're got insurance on your own or it's through your healthcare company and you have a prescription drug card, you go to the local pharmacy and you pay $10. We're the company behind that. So people hire us to provide that benefit, and we have arrangements with pharmacies throughout the country, and we also own what we call our own mail order facilities. So we can dispense drugs for 90-day supplies for people at low cost.
Okay. So I was recently a business development executive at Echo, which is a digital marketing agency, part of Ticketmaster Entertainment. And so I was given, as part of my benefits package, a Blue Cross card that I had in my wallet, and then I had a card that said Medco on it that I was supposed to show at the pharmacy. Now, I'd never had that before. I'd always had just a Blue Cross card, and you show it at your doctor's office and the pharmacy. So is Medco the same? Are they a competitor of CVS Caremark?
Yeah, I would say they're our biggest competitor. They do the exact same thing. And sometimes you can have, separate cards, and sometimes your health insurance company will allow you to put it on that card.
Okay. So then who is it that you are making deals with? Is it the company like Echo Ticketmaster, or is it Blue Cross?
Well, that's another great question. We actually have two different markets, Mark. First one is with Echo. People on my team would go out to Echo and try to sell them to say, get your health insurance through Blue Cross, but get your prescription drugs through us because we can provide you better pricing and better reporting and service. Then we have a whole nother division that goes to the health plan and says, for all of your members, let us be your drug benefit provider.
Got it. And then how is it that you set yourself apart from your competitors?
Well, that's a complicated answer, but what we really focus on is improving savings for the clients and for the members and having a good member experience. And what we do is we provide solutions to our clients that will help the clients themselves save money and their members get low-cost drug alternatives. So it's really from a member standpoint, we're trying to educate them on that there's generics available, which are basically the same as brands nowadays. There's other ways to save money so they can have an affordable health care. And from a client like Echo, for instance, we're giving them deep discounts and we're giving them programs that will help encourage people to use mail order pharmacies or to use generics because that's the way they save the most money.
Okay, got it. And are PBMs all over America? If somebody, and I'm sorry, we should say a PBM is short for pharmacy benefit management company or prescription benefit management company, right?
Correct.
Okay. And are PBMs all over the country? Are there jobs, career paths in PBMs all over America?
Yeah, there are a lot of PBMs. To my knowledge, over 30 different PBMs throughout the country. Most of them have national offices and sales forces and account management forces. I would say there's three big ones today, which is CVS, Caremark, Medco, and Express Scripts. But there are a lot of other companies that are, I would say, mid-range. But there's many opportunities in this field.
Tell us what it is that you do over there. What is your role as an area VP? What does that mean?
I am responsible for $2.5 billion of business, and I manage 10 people. And our job is to keep our largest national accounts happy and keep them as Caremark clients and try to make sure we renew them as well as provide them additional opportunities to save money. So it's really focused on retention and keeping a high level of service.
What is the type of background that you see on your team?
A lot of the people on my team started as young people within the company, whether they were in customer service, billing, or even as an account manager, and then they've worked their way up into what we call a strategic account executive. The other people have maybe come just from working at a hospital or some other part of the healthcare field, and they've transitioned into it. Sales is a great thing because you're always talking to people and you get to meet people, different people all the time, and you're trying to get people to trust you to buy whatever you're selling, whether it's a product or a service. They're buying from you. It's not actually what you're selling. So, it's about trust. It's about just having people believe in what you're saying, and it's a challenge, and being competitive is a good thing, and you gotta maximize that to help you excel in your sales role. So, I think sales is a great field to be in, and it gives you that ability to have flexibility as well.
You've been watching a short version of the interview with Bob Eisendrath. To learn more about pharmacy benefit management companies and the sales and account management roles there, go to careersouththere.com. Thanks again for watching. I'm Mark Luber, and I look forward to seeing you at the site.